Welcome to the April Translational Science Seminar Series From Barriers to Breakthroughs, Translating Research Innovation into Health Impact. The title of today's presentation is Engaging Community and Health Research Following the East Palestine Train Derailment. We want to thank everyone who participated in the annual spring conference on March the 31st. Your participation in our conference is integral in making it a successful event each year. Following today's presentation, you will receive an evaluation via email. We encourage you to complete the evaluation. The CCTS provides certificates of attendance for anyone that would like one for their records. As a reminder, you must be present for the speaker's entire presentation to receive a certificate of attendance. A link for the certificate of attendance will be located at the bottom of the program evaluation. The objectives of today's presentation were included in the presentation invite, and today's speakers have no disclosures to make. Today's speakers are Dr. Erin Haynes and Miss Misty Allison. Dr. Haynes is a Kurt W. Dushall Professor of Preventative Medicine and Environmental Health at the UK College of Public Health. Dr. Haynes has spent her career focusing on community environmental health. Currently, she is the PI of the National Institute of Environmental Health Sciences funded East Palestine Train Derailment Health Research Program and the PI of the P30 funded Center for Appalachian Research and Environmental Science, better known as UK CARES, as well as a number of other additional NIH grants related to environmental health. Ms. Allison received her Master's of Public Health from The Ohio State University. She is the leader of the East Palestine Community Advisory Board and a fierce advocate for those impacted by the train derailment. In 2025, she received the Ohio State University Alumni Association's Robert M. Duncan Alumni Citizenship Award for her public health advocacy in the aftermath of an environmental disaster in her hometown of East Palestine. Please join me in welcoming Dr. Haynes and Miss Allison.
Thank you so much, Dr. King. It's a pleasure to be here and to share with you our story of community engaged research for the community of East Palestine after they experienced that tragic train derailment that occurred in February of 2023. So the slides are beginning to load. Fantastic. We can go to the next. And I am thrilled today to include, we have many community partners, but this is Misty Allison, we'll say is the one, the key community partner that's really been instrumental in working with our team and decide as a part of the team to decide all the best strategies. So I'm very pleased to have her willingness to join today and also to give you the perspective from the community about what it was like to experience this from the community's perspective. I think we need to hear that first before we talk science. So
Yeah.
Misty.
Hey, yeah, thank you so much, Dr. Haynes, and thanks so much for inviting me to be here today. Before we dive into all of the great work that we are doing in the community, okay, there we go. And there's the nice little pictures of us with the introductions. Okay, so before we dive into exactly what we've been doing in the community, I think it would just be great to just level set for a minute on exactly what happened in East Palestine and why we're still talking about it 3 years later. So before February 3rd, 2023, nobody in pretty much the entire world knew anything about this tiny village in East Palestine, Ohio, which sits on the Ohio, West Virginia, and Pennsylvania border. So on February 3rd, 2023, around 9 o'clock at night, a Norfolk Southern train derailed. At first, we thought that maybe just something minor happened, but then we quickly realized that this was a really big deal. So 38 cars derailed, and 11 of those cars contained hazardous materials, and it led to evacuation on that night of a 1 mile radius. The fire continued to burn, and on February 6th, emergency crews conducted a vent and burn of 129,000 gallons of vinyl chloride from 5 tank cars. So you can see the picture there. It just looked like, like an atom bomb went off. And later that year, there was the NTSB investigation report that was released, and it was deemed that that vent and burn was not necessary. So on February 10th, the EPA reported in a letter to Norfolk Southern that the chemicals that were on the car containing vinyl chloride, butyl acrylate, ethyl hexyl acrylate, and ethylene glycol, vinyl butyrether, were released during the incident and were detected in samples in the soil and in the water, some in the air as well, which obviously sparked a lot of concerns because just 2 days before that, the evacuation order was lifted, and we were all told that it was safe to come home. So at the end of February, the Ohio Department of Natural Resources announced estimates that there were, over 38,000 minnows and about 5,000 other aquatic animals that passed away from the contamination. Thankfully, there were no human deaths during the derailment, but just because there were no fatalities during that doesn't mean that this preventable disaster, should be taken any lightly than it should be. So because of all of that, what we wanted to share here was there were a lot of community concerns. So that was in regards to the ongoing cleanup because the train tracks were put on top of the contaminated soil, and Norfolk Southern wasn't going to do anything about it. They just wanted to get the railroad up and running as soon as possible. So the community was rightfully very concerned about that. There was just a lot of anxiety about our health and just distrust in what was going on. There were a lot of concerns about the drinking water. A lot of people in town some are on like a public water system, and so people were concerned about that. But then there's a lot of people in this Appalachian community that are on private wells, and so just very concerned about potential contamination. There were concerns about like dioxins, just delayed testing results. People weren't getting indoor air, tested. And then when people came back into town, there were some lingering health symptoms. So headaches, nosebleeds, rashes, very much like acute symptoms that have, morphed for some people into some more chronic conditions over time. So there was just a lot of concern and distrust in the community that still lingers for some. Because of that, and because of all of the work and partnering with Dr. Haynes, we did very quickly form a community advisory board. And this is our current community advisory board here. There's a lot of people on this that are absolutely incredible. So we have individuals who have medical backgrounds. We have the village manager who's part of this. We have representatives from Western Pennsylvania because they were impacted too. This wasn't just an Ohio event. We have representatives that support like the aging population and what they would want for study design. We have a reverend because faith is very big in this community. And then also local nonprofit executives because they do a lot in the community and community members trust them. Rusty is actually in our Cambridge, Ohio area, which is our comparison group, which Aaron will talk about soon. Rudy is a firefighter, and obviously the first responders are a very crucial subsegment that we're focusing on since they responded, and Aaron will talk about that a little more. And then Dr. Vins is actually our health commissioner for the county. So all of these individuals have been able to provide very robust and honest and candid feedback on everything that we are doing. Aaron, do you want to talk about the first steps of the study?
Yes, thank you, Misty. And I'm always re-traumatized after I hear your story of how the events that occur. But it leads up to immediately after the derailment. I want to say that it's researchers, we should never just jump into a community that is experiencing, I'm going to say, such trauma, because it's just an added to the trauma when researchers come in. I had existing partnerships in East Liverpool, Ohio, which is, you can see on the map, it's just below East Palestine, and in Rogers. So I had already existing studies going on nearby, and my staff sent text messages, images of the images that Misty just showed you, and said, what are we going to do? So we already had a team in place, but we yet didn't have the East Palestine, Ohio connections. So when Misty and I were serendipitously introduced, and in fact, it was from a relative, Misty, that knew someone at UK.
Yeah, it was my husband's cousin. She actually works at UK, but in the College of Education. And so there was a story in, I think, one of the employee
Yeah.
newsletters of the work that Aaron was doing in East Palestine. And so she saw that and reached out to Dr. Haynes and said, I have
Yeah.
family that lives in East Palestine. Like, do you want to talk to them? And then so she was like, hey, just so I reached out to Erin. I'm not sure if she's going to respond to me or not, but it sounds like Dr. Haynes responded right away and
Yeah.
we connected and hit it off immediately. So it was
Yes.
kismet.
It's great to have connections. It was wonderful. So we're indebted. We need to find out who that faculty was again, Missy, and reach out and give them a thank you, a big thank you hug. All right. So the derailment occurred in February, and in surveying what was going on, the EPA was collecting a lot of environmental data. And you just got to be careful not to step on the toes. So they were already in the throes of collecting soil and air. And so we saw a gap, and the gap was human health. It was public health. So we launched a health tracking study, and we were able to recruit 400 people from the community. We've now followed them over 4 different time points. Still working on the manuscripts and papers to go with it, but we can share with you some of the early findings that then led to this new funding mechanism. We can go to the next slide. I don't know, Misty loves this picture of me, but this is an overview of the health tracking study. We enrolled the health survey participants, capturing their health experiences over time. We also expanded out and were driven by what the community wanted. The advisory board members would tell us dioxin's really key. We need to know if dioxin's in our body, in our systems. So we organized a pilot study to collect serum and blood, for dioxin testing, and partnered with the CDC on that. As Misty said, there was a big lack of indoor air testing, so we responded with some indoor air quality measurements. So everything that we did, we partnered, and we also did wristbands. We did focus groups. But whatever we did was based on what the community said was needed. Because we're not residents of the town. We don't have that feeling of what's needed and the urgent issues they want addressed. So all of these things that we did were based on what they said and deemed were important. And that just happens to be a village council meeting where I was sharing back some of the serum dioxin values. Okay. Which Misty organized. So she was able to get us in contact with the village council, and that's how we were able to share back this information, and they really appreciated it. So just some examples of the health data or the health experiences that our participants reported. And you can see it's over 4 time points. Respiratory was the number 1, followed by headaches. And then this just general tiredness, weakness, GI issues, and rashes were, a lot of rashes were reported. And there were also none. So some people did not experience any health symptoms. And I think that's really important to, that we document and say it doesn't affect everyone the same way. We're all individuals and unique, and these types of exposures can impact people in different ways. It can also impact people. They may not have a current symptom, but something could come forth later in time. So that's why it's important that the community joins research so that we can follow them over time. And we started also to begin to see reports. We had the other field. So I encourage anyone who's doing community work to add a field for anything else you want to tell us, or any other health symptoms we didn't capture. And we started seeing in the other field issues with menstrual cycles. So we added that to the next rounds of surveys. And of the women in reproductive age, we were seeing many more women reporting that they had issues. So we wanted to include these primary health outcomes into our next big study. The other part I wanted to pull out as separately is stress, mental health, and we screened for PTSD, and the levels were, around 40 down to about 30% of our participants, which is really quite high for screening of PTSD. I believe I've seen numbers from, like, let's say the World Trade Center, 9/11, when that occurred. The community residents were in the 20% of stress levels. So this is another area that we're pursuing in this new expanded project. We can go to the next. So the other role of our community advisory board was to help translate the information that we were receiving back to the public in a clear, understandable manner. So the research team would create like a draft, like an example, and then, I loved it. They would just like turn it on its head or say, no, this is how we want it to be displayed. Make sure you say or include information about, XYZ. So these fact sheets were built with community feedback, each one of them. We did not publish or push forward anything unless it had been vetted and multiple revisions later. Anything you want to add to those, Misty? So fact sheet development?
No, I don't think so. I think one thing is something that I think some of the researchers were maybe surprised by is how involved the community advisory board was, because I think that there is potentially like a preconception from some people, not from everyone, but because this is like a tiny village in Appalachia, that maybe some of these health concepts would be not very easily like understood. And so I think it's just, I would encourage whenever you're doing research, if you can share it with a subset of the community ahead of time. Like, we got so much good feedback. So I can think about our one CAB member, Barb. She's the one that represents some of the aging population, as she calls it. And she was like, no one's going to read this. This is like the first version. This is super confusing. Like, essentially, people just want to know if they're dying or not. So like, just get to the punchline and like, let us know. And so like, we really appreciate that candid feedback. And so it's like, if you ask people, they're going to tell you, because it is so personal to them. Like, health is such a personal topic, as you know. And so whenever you're able to give, part of the community a seat at the table, we really take it seriously and do our best to provide feedback. And the great thing about Erin and like her research team is there's really no like ego involved. She's just like, yeah, I can see what you mean. Let's change it up. Like, sure, if we're going to rip this whole version apart, like, yeah, that took a lot of time for us to do. But being able to have like the community of the core and like at the heart of everything that we're doing, that really shines through what we're doing. And, Dr. Haynes allows that to happen because she does really care about the information being valuable. to the community.
Thank you, Missy. And that's very, very true. The purpose, we always have to come back to why are we doing this? So, there's some scientific for pure science questions, but really it's research that's with and for this community. So if they're not involved, then it's not as powerful or impactful. So when we think about translation and impact, this is the way to make that all happen, of having them tell you essentially what to do. They're not the only ones telling us what to do. We have a scientific advisory board, and I love it. So the science coming to a community that has high level of expectation or questions, and they are looking to the experts. And I can attest, I do not know, I'll just public forum, I do not know everything. I need to have, this multitude of expertise. We have, sociology, the former director of NIEHS, genetics, environmental epidemiology that's focused on large scale studies, laboratory analyses, collection of samples, children's environmental health. We have a pediatrician, etc. Neurologic, mental health. So all of these individuals were invited to participate and give us advice on the science, so that we bring to the table to the community the best that we can. And a lot of that work is here at UK, but there's also partnerships. Mount Sinai, Bob Wright is listed. They're going to analyze some of our samples. So we want to bring the absolute best that we can. So this is a great group of people. And because the translation to the public and the impact is so important, we formed a clinical and public health task force. So these are, I'll let Missy, maybe these individuals and you helped to select many of them. Do you want to talk about the reason, the real significance of this group?
Absolutely. So what we kept hearing from our community advisory board and from the community in general was like a couple of things. So one, we don't just want to be research. We don't want to be lab rats or guinea pigs. We want something to actually be done with this. We are fine with people, jabbing us with needles and wanting our urine and our hair and our toenails. Like, that is fine as long as you're actually going to do something with it and it's going to help with clinical outcomes. Because a big thing that we were hearing in the community, and I saw this, I live in the community, this has happened personally, and have very many anecdotes and heard this from just people in general in the community. You go to a provider and you say, I'm having this issue, could it be related to the train derailment? And they go, I don't know. There's no current way to document this. There's no systematic information out there. There's not a registry in place already. Providers are not being educated. And so this was something that the Community Advisory Board continued to bring up. And when we got this additional funding from NIEHS to develop this actual health research program, which is what we're talking about now, what we talked about before with the health tracking study was the first phase, and it helped inform what we're doing now. And so this was something that we wanted to do, was to not only continue with the Community Advisory Board, but to have the Scientific Advisory Board and this Clinical and Public Health Task Force that you see on this slide. So there are, our chair for that is Kristen Bearfield, and she's a mental health therapist. And since mental health and stress has been a huge thing that unanimously everybody can agree that there's been huge stressors here and some huge mental health ramifications. So she's leading the charge on that. Amanda Amato is a registered nurse, and she is the health services administrator for the county health department. So that's been great. We have toxicologists that are on here. Stephanie Kahn is the chief executive officer of East Liverpool City Hospital, and they're the ones who have the East Palestine Clinic directly in East Palestine that we're partnering with for the clinic visits that we'll talk about. So it's just a really robust cross-functional group of practitioners that have provided a lot of great feedback about how we can take the research findings and translate those into something meaningful for the clinicians in the area. And so they've been a very involved group, extremely helpful,
Yep.
as well as the scientific advisory board. They're just all
Yep.
so smart and so passionate, and it's been a great addition to everything
Yeah.
that we want.
And the other component they're adding to, as I'm thinking about this current study, is what are patients presenting with when they come into the clinic? What are you seeing? And they've been very helpful in informing our health survey questions going forward, because they're, boots on the ground seeing people, and we don't want to miss something. So they've been very, very helpful, as Misty said. So our new study, this big health program, includes measurements and outcomes, obviously with lung, respiratory, cardiovascular, mental health, reproductive, and also liver and kidney function, which, yeah, we'll go into each one. And these are slides too that we shared with the community in a town hall on the anniversary of the derailment just this past year. And because this is a science audience, I want to share who's eligible to participate and be a part of this study. We're taking a very broad look at the surrounding area of East Palestine. We want anyone to feel welcome and invited. So Western Pennsylvania, obviously the East Palestine community, and then if they were 8 years old or older. Also the workers, those who responded to the derailment. And as we were talking at the very last meeting that we were in February, some of the media that were there told us, like, well, you know what? I responded because I was there and I had to get close to the site as we were filming and doing their, reports. So it's like you were exposed to. So we've now expanded our, responders to even those who were in a journalistic reporting manner, because they were exposed. It's one of the journalists was actually pregnant at the time, and even asking herself, should she be here? Should I be doing this while, carrying my infant? And as Missy alluded to, Cambridge. So we have a comparison community. One of the challenges with, environmental exposure, et cetera, is who can you compare them to? Because it's hard to do it maybe just with one community. So we are recruiting and getting ready to launch the recruitment in Cambridge, Ohio. Same criteria, lived in the area since 23, and they're socioeconomically similar, so it's very reasonable. We really want families to be a part because we want to follow over time. So we really are encouraging families to join. And just so you can see a lot of the expertise here at UK, we have Dr. Radmila Choate and Mark Worth really helping us build the respiratory health component. We're going to do spirometry. Our team was hired in East Palestine, and they were just trained last week, 2 weeks ago, on spirometry by Dr. Roy McKay at the University of Cincinnati. Cardiovascular health, definitely looking at the effects on cardiovascular function. Beth Lacey is in the College of Public Health. NIEHS has offered to provide us with body composition scales, which is fantastic. They're in the process of being shipped to the clinic now. And then our scientific advisory board suggested that we look at what the University of Louisville has been doing with the Green Heart study and looking at arterial stiffness. So we are in the process of planning to order the equipment. Interestingly, Misty met one of the marketing individuals as part of her presidential leadership scholarship program. And we're hoping to talk with her this end of the week to discuss maybe a discount or somehow using it for the study, relying on all of our great contacts. So Louisville is also providing advice here. Dr. Tess Smith-Thomas is really working on developing this large protocol for adults and children on mental health. And again, it's a very broad view. We want to look at all things at the very beginning. And then as the study moves forward, we can dive deeper into things that we're seeing. And you can measure levels of stress in hair. And so that's going to be done at Mount Sinai Medical Hospital. All right. Reproductive health. Very exciting to be able to do this work. Dr. Catherine Hartman is just the expert on this. And she is with Dr. Patrick Hannon here at UK also. And then NIEHS is really interested in being a part of this, even scientifically. So Anne-Marie Jukic is a part, and so is another colleague at NIEHS, and I've just failed to put her picture on the slide. And her expertise is in more children and adolescents, females, as they are entering their menstrual cycle and history. So we're planning a big future study on reproductive and menstrual health. Next. And I just wanted to give you this big overview so you could see the work we're planning. And we're open too for, we want to give them the best. So if you have an idea or something that you think would be helpful here, we're all ears. Cancer. Obviously, cancer is usually the community's one of the number one concerns. And we've pulled together a team with, we have a great Markey Cancer Center here. And this is just a fantastic team to look at, and making sure we store the right samples for future analyses. Okay. And Jay Christian is also going to do some modeling and mapping for us. And I think I have that, in a future one. So in our pilot studies, when we did the dioxin and serum, another tube that we collected was immune response and immune function. And Dr. Ilham Lusadi Powers is a world-class expert in this. And they have a paper that's under final review just on this pilot data. But we've now built a very large protocol with SIVA, and it's fantastic. We're going to collect plasma and look at the East Palestine and Cambridge, comparing their immune markers. One of the biggest challenges with immune measures is finding the best comparison group. So now that we have that in place, I'm really excited and look forward to seeing this information, because as you know, inflammation and chronic stress can lead to, obviously chronic inflammation, which can actually affect almost every organ in the body. So these data can be used for analyses with all of our health outcomes. Very excited.
And we also saw some elevated levels of inflammation in a pilot study that we did. So this is why Dr. Haynes wanted to lean in on this, what we were seeing in some pilot studies in the community.
You're right. And we are leaning in this one in a big direction. Liver and thyroid function is a partnership. So when this research program was announced and, lots of universities were vying for it, they funded 3. University of Kentucky is the lead, and we've received 90% of our budget through the ask. University of Pittsburgh is leading. They received funding to lead the liver and thyroid function assessment by Julianne Bayer, and we're doing clinic analyses, clinic samples, but also fiber scan, which is a very non-invasive liver assessment. So Julianne and her team will be doing that as part of the full clinic assessment that we have. And the other component, if you go to the next slide, is a water modeling project, and that's being led by by Yale scientists at Yale University. Nicole Gazel and Michelle Bell. Data analysis. So as you know, data analysis, this is ultimately rubber meets the road. Let's figure out what we're seeing, how to make sense of the information. We have individual data. We're going to have state level data. Each of these states epidemiologists we're going to be working on MOUs for data sharing so that we can look at data that they normally collect prior to the derailment and then over time. So I'm really looking forward to working that through. And you can see we have a great team. This core, data analysis core, is co-led by Kristen McQuarrie and Tony Mangino. And Jay's going to lead the geospatial. And Cody Baumgartner is, as you know, he's really strong in the AI world. So some of our data will be on the backside of the UK server with some AI analyses. Couldn't do a study without a team. So we have our senior project manager, Tim Hilbert. Don Bryant is helping us with a lot of the event organization, making things look good. She's just, helping at all. Every road we turn down, Don is there. And then Nerlin is our data management. So the burden on REDCap, building our REDCap database is huge. And he's in the fight. He's doing it. He and Tim Hilbert are working very, very, very closely over the last several months, getting our health survey in place. Yes, and I want to highlight two of our clinic sites, the East Liverpool City Hospital, which has its affiliate as East Palestine. I don't have a picture of their location. It's new and cute, and they're going to do a grand opening for their new location at the end of the month. And then the Cambridge site is this Mid-Ohio Valley Health Center. And we have the second floor where the windows are on the right-hand side. They're letting us use that space for the clinic outcomes or clinic measures for the Cambridge community. Misty, you can take this away.
Yeah, Aaron. So we thought when everything was going on initially, we were hoping to have everything up and running. We got the award in October and then hoping that it would be like January 1st, we'll be ready to go. But everybody knows it takes longer than you think it will. And so, putting my marketing hat on, I was like, how can we make a big splash with this? And so I was like, well, hey, February 3rd is coming up. There's always attention around the anniversary now that it's like a couple years in. Before it was like everybody was thinking about East Palestine all the time in this area, but now it's more of just like an annual type of thing. And then so I said, well, if we don't control the narrative, somebody else is. And so let's try to make this as positive as possible. And I said, is it possible for us to do like a grand opening event and have some fanfare around this? And then people liked the idea, and so we made it happen. We had the whole team in town for about 3 days. It was really great. We can talk through a couple slides of different things that we did to help inform what we're doing. And so right here you can see there's a ribbon cutting ceremony. Dr. Kyle Walsh from NIEHS was able to come, and he gave some opening remarks and was with us to listen to the community. And so that was really great. Some other things that we did too, we had a community meeting on February 2nd to just kick off everything, because people knew that this money was awarded, but then, nothing really happened. So we wanted to tell the community, what we were planning, how everything was going, and what to expect. And so Aaron got up and talked about essentially the presentation that we're sharing with you right now. Dr. Baer talked about the liver and thyroid function and everything that her team is doing. And then Dr. Diesel and Dr. Bell from Yale came. Dr. Sayers was unable to attend. So we all talked. There was a documentary that was also shown during this time to do some community engagement from a local documentary crew called Riverwise. That was very powerful. And Dr. Walsh talked again. And then Aaron always likes to show when we were setting up, my daughter was singing K-pop Demon Hunter songs and entertaining everybody. She has a 0 personality from what you can see here. She's I'm just kidding. She's full of personality and loves to be the star of the show. So she loved that there was like a little film crew just recording her. So the next morning on February 3rd, we did a joint meeting of our community advisory board and our clinical and public health task force, along with all of the researchers that were there from the universities. It was such a good meeting. This was the very first time that we had ever brought those two groups together. And there was just like so much synergy in the room talking about, well, community members feel this way, with the providers talking about, well, here's what we're hearing, here's services that are in place. Like, for instance, we have this cancer levy, and Dr. Vins from the health department was like, it's very underutilized. Let's figure out how to use these resources together. East Liverpool City Hospital and like their chief medical officer was like, stood up and said, look, what we're hearing is like there is no registry in place at all. So that's like our top of mind priority and, a gap that is still here. So it was very powerful, and there were a lot of actionable takeaways from that. And then to kick off the event too, if we were doing it chronologically, maybe we would have had this slide a couple of slides beforehand, but that's okay. We had a really nice dinner to kick off everything, so all the researchers could meet each other. And then we invited some local leaders to join us too. So we had the East Palestine mayor came, the East Palestine village manager, and then there are some smaller villages that border East Palestine that have also been impacted in New Waterford and in Columbiana, and they came as well. So that was really great for us to talk with them, to the researchers, to talk with the leadership, to say, what have you been seeing in the past 3 years? What have you been hearing? What do you think that we need to know as researchers for coming into your community, since we want to do this with and for your communities? And so that was just a very valuable way to get some candid feedback from these individuals. And I'm so glad that we did that together. Okay, one thing too that we did on February 2nd, we did some listening sessions that were really powerful. We did some listening sessions in Western Pennsylvania, and then we also did some sessions for Ohio residents, and that was in East Palestine. And that was really important because the residents shared, experiences of what they've been through, what some of their ongoing concerns are, what are some of their ongoing like health ailments that they've heard in the community. And the reason why we separated those is because Western Pennsylvania did not get as much support and resources as Ohio did, since the actual event happened in Ohio. You would think that they would get the same resources because like the plume went directly over Western Pennsylvania. And so they were definitely exposed, even potentially more so than some of the East Palestine residents. You could definitely argue that, but they've had separate experiences. And so it was so crucial to be able to go actually in their community in Pennsylvania and to say, we're listening to you. We want to hear how this has impacted you. And as what Aaron was talking about earlier with PTSD and some of these health symptoms, there were so many tears during these sessions. 3 years in, the anxiety is still real. People very much still worried and, talking about what their families went through 3 years ago. I think that was really powerful for the researchers to see and to really humanize everything that we're doing as a research team. One thing here too that we wanted to show you is a lot of the just marketing and communications that goes into a study like this. When you are working with the communities, as you know, you have to be able to market what you're doing and to also educate the community about what's going on. So these are just some examples of different collateral that we've put together. We're in the process of putting out some mailers to about 7,000 local households, inviting them to sign up for the study. It's now almost up and live, so that will be very exciting. There's just some marketing materials here from the leadership luncheons that we had, examples of fact sheets, and we can provide information like actual, like PDF versions of this too. Some recruiting flyers that we have. And then Erin had a really great idea, and I loved this. And so she said, hey, Misty, like I want to do a certificate of achievement for the kids that go through the study. She's like, I remember doing stuff like this when I was a child, and let's try to do something like this. So we put together a certificate of achievement, and then the clinic staff, when a child participates in the study, because that can be very stressful for a child to get their blood drawn and whatnot. And so they'll write their name in, and then Dr. Haynes and then Dr. Bear are going to sign the certificate so they can, keep that forever if they want in their little shadow box or whatever. So we're very proud to showcase the different collateral that we've provided. And then also, too, we can give you a link to this. We have a website that Don Bryant has done a phenomenal job of putting together and bringing to life. So any type of updates that we have, we put them on here. We have a weekly update that we send out via email too, and we have a local East Palestine NIH funded study Facebook group, and we post them on there. And so we're definitely trying to get the word out as much as we can. Is there anything else that you want to add, Erin, before we go into hearing questions?
Nope, that's great. Yes, we'd love to hear your thoughts, take questions. If anything needs clarified, happy to just open it up to you. Thank you for presenting with me today, Misty. It makes it so much more real and, real when you share the story.
So, hi, Erin. I have a question. It's more of a long-term question. What, who pays for the health care for people that were impacted by this long term after these sorts of programs wind down? I mean, will people's private insurance pay for this, or
That's a
will
good
there be other
question.
resources?
That's a very good question, Vicki. There, I'm going to let Misty talk about there's a consent decree, and there's also legal actions that are occurring, and there is a plan for a health monitoring as part of the settlement. But what we are proposing as research is different from what might be under or covered by insurance. So like spirometry, I don't know if that's billable. So this definitely is research. So we know that NIHS is committed to funding this work, and we are hoping that this initial 5 years, they only give you money for year one, but this initial 5 years is just the beginning, and we plan to go for decades and following and tracking, especially I want to, again, the families and the children, so over their entire lifespan. But that's a good question. Missy, do you want to mention the medical monitoring or the
Sure.
decree?
So a couple of things with that. So as what Erin was saying, one of the benefits of enrolling in this health research program is that the testing is at no cost to the participants. Going through and doing, the community outreach, we have like incentives that people will get, like a $25 gift card, or like if they complete the health study, they get like a little over $100, for instance, etc. But there is not one person that has been like, that is the primary reason why I'm doing this. Everybody is saying, I'm scared. I want to see what's going on with my body. There's no standard protocol in place. Besides, if everybody's just getting like their annual physical, for instance, like you would get, from your doctor, that's essentially like it right now. There's no standard like recommendations of different tests that providers should run, etc. So people are just very grateful that we are doing testing for as much as we are testing for, and how that's not being billed to insurance and it's at no cost. In regards to the consent decree and the medical monitoring, as part of that lawsuit settlement at the federal level, there is, I believe it's $25 million that is earmarked for healthcare that the EPA was able to get from that, which we hear is very unprecedented that they were able to get that funding that for Norfolk Southern to agree to. Until all of that is completely signed, sealed, delivered, approved, none of those funds have been submitted to the community. The way that it's written in there is that Norfolk Southern was able to select essentially like a contractor that was, going to put like a healthcare plan in place for that medical monitoring program. They had shared a little bit of what they were thinking. And then there was like an open comment period, and a lot of people provided comments and feedback, including our health commissioner, and that's part of the public record because honestly, it was really lame. It was really disappointing. And it was just, it wasn't going to do any more than like what you're getting with your annual physical. And so that was honestly sad. And so, we had provided feedback about, yeah. Sorry, it looks like I'm frozen, maybe.
Nope, you're still good. Maybe the video is.
Yeah.
Um,
Oh, that's great. You can
that's
start
okay.
talking.
Yeah.
You can finish that,
So-
Aaron. I'm stuck in a weird.
Yeah, that was a good question, Vicki.
So kudos to you guys for everything you've done. And I wish that there was some interaction. I'm thinking with your scientific and medical boards that you've put together. It's amazing what you all have done in a short period of time.
Oh, thank you. We're in the throes of it right now. So no time to reflect on the good that we've done because we are very close to launching to everyone that submitted an interest. Right now we've collected names and emails and phone numbers, etc., for those interested in joining. And we have about 1,000 people who are interested right now. And we've not even printed or sent out all the marketing material. So we're hopeful that we have a lot of interest. So this is funded under an OTA. It's an other transactional award with NIEHS. And this is the first one I think that NIEHS has ever administered. So NCATS is actually administering it with them. But the reason I mention it is that we have flexibility. So if more people want to sign up, and we don't want to let anyone not have the spirometry or the cardiovascular measures. So my plan is if more people sign up than we originally budgeted for, I'll go back and say, look, the community is really turning out in numbers, and we want to give everyone the chance to have these measurements. So that's the good part about an OTA. It can be responsive to what we're seeing as as data, and then we can go back for additional funds if needed. They're always going to ask us to rebudget first. Can you do this already with what you have? We can see there's a lot of opportunity across the board in terms of science and research, in terms of education and outreach, communication and web development. We're going to work more closely with Riverwise in the future on the documentary kind of side of it and videos. It's quite, I'm going to say, as comprehensive as we can get, because that's what the community deserves and that's what they need.
Well, if there aren't any other questions, we want to thank everyone for being here today and thank Dr. Haynes and Miss Allison for presenting.
Yep. Thank you for having us.
We have one other question, Erin.
Yeah. That's true. Andrew, I didn't mention that, but that is very true. When they say they can be flexible and give you more, they can also say, and we can take it, because if we don't perform, if we don't do what they expected or what we wrote, yes, that's a possibility. I don't dwell there. I dwell in the let's grow, not in the let's retract. But we can rebudget. So if something isn't working out, or we're not seeing something important in a certain area, the direction that we were going, we can internally rebudget based on other things that we are seeing. So it can be strategic in where the money goes. But yeah, you're right. Nope, no guarantee of a minimum. I'll be glad to tell you more about it as we go through. We're still in year 1.
Okay. Well, thank you, everyone, and have a great rest of your day.
Great. Thank you.
Thank
Yeah.
you.